Hey everybody, welcome back to Drug Talk. As always, my name is Garrett Campbell. In today's video, we're going to be going through this monograph here for fluvoxamine, or Luvox, and we'll jump right into it right now. You can see here on the front page, it's a film-coated, scored tablet available as 50 milligram and 100 milligram tablets. We'll scoot past the table of contents here. And just before I jump into the information about this medication, keep in mind if you don't want to watch this full video, I will chop up this video into smaller videos covering each topic of the monograph. Okay, so we'll start off with indications and clinical use. So Luvox is indicated for depression. So fluvoxamine may be indicated for the symptomatic relief of depressive illness in adults. The effectiveness of Luvox in long-term use has not been systematically evaluated in controlled trials. Therefore, the physician who elects to use Luvox for extended periods should periodically reevaluate the long-term usefulness of the drug for the individual patient. And now we have some information here that it's indicated for obsessive compulsive disorder. So Luvox has been shown to significantly reduce the symptoms of obsessive compulsive disorder in adults. The obsessions and compulsions must be experienced as intrusive, markedly distressing, time-consuming, or interfering significantly with the person's social or occupational functioning. The efficacy of Luvox has been studied in double-blind, placebo-controlled clinical trials conducted in obsessive-compulsive outpatients. The usefulness of Luvox for long-term use, so in other words for more than 10 weeks, has not been systematically evaluated in controlled trials. Therefore, physicians who elect to use Luvox for extended periods should periodically reevaluate the long-term usefulness of the drug. Now, what about this medication in geriatrics, so patients greater than 65 years of age? So since there is limited clinical experience in the geriatric age group, caution is recommended when administering Luvox to elderly patients. So it can be used in the elderly, you just have to use extra caution. Now what about pediatrics, so patients younger than 18 years old? So Luvox is not indicated for patients below the age of 18 years old. And it says that there's more information in the warning section, which we'll get to. Now what about contraindications? So patients who are hypersensitive to this drug, or any ingredient in the formulation, would not be able to use it, so that would be a contraindication. Co-administration of Luvox with a monoamine oxidase inhibitor, including methylene blue or linezolid, would be a contraindication. So more information here about that. In patients receiving selective serotonin reuptake inhibitors, in combination with a MAOI inhibitor, or an MAOI, there have been reports of serious, sometimes fatal reactions, including hyperthermia, rigidity, myoclonus, autonomic instability with possible rapid fluctuations of vital signs, and mental status changes that include extreme agitation, progressing to delirium and coma. These reactions have also been reported in patients who have recently discontinued SSRI treatment and have begun treatment with an MAO inhibitor. Some cases presented with features resembling serotonin syndrome or neuroleptic malignant syndrome. So at least 2 weeks should elapse after discontinuing an MAOI before starting Luvox. Also, MAOIs should not be introduced within 2 weeks of stopping Luvox. Co-administration of thiazidine, mesordazine, pimozide, terfenadine, some other medications listed here. Each of these drugs alone produces prolongation of QTc interval, which is associated with serious ventricular arrhythmias, such as torsade de pointe, arrhythmias, and sudden death. So Luvox has been shown to increase plasma levels of some of those medications. It's also contraindicated to be used with tizanidine. All right, we'll now discuss warnings and precautions associated with fluvoxamine. So potential association with behavioral and emotional changes, including self-harm. Pediatrics. So placebo-controlled clinical trial data. Recent analysis of placebo-controlled clinical trial safety databases of SSRIs and other newer antidepressants suggests that the use of these drugs in patients under the age of 18 may be associated with behavioral and emotional changes, including an increased risk of suicidal ideation and behavior over that of placebo. Adults and pediatrics. There are clinical trial and post-marketing reports with SSRIs and other newer antidepressants in both pediatrics and adults of severe agitation-type adverse events, coupled with self-harm or harm to others. The agitation-type events include akathisia, agitation, disinhibition, emotional lability, hostility, aggression, depersonalization. In some cases, the events occurred within several weeks of starting treatment. Rigorous clinical monitoring for suicidal ideation or other indicators of potential for suicidal behavior is advised in patients of all ages. This includes monitoring for agitation-type emotional and behavioral changes. Young adults, ages 18 to 24 years. The recent FDA meta-analysis of placebo-controlled clinical trials of antidepressant drugs in adults, patients ages 18 to 24, with psychiatric disorders showed an increased risk of suicidal behavior with antidepressants compared to placebo. So akathisia, or psychomotor restlessness. The use of Luvox, or fluvoxamine, has been associated with the development of akathisia, characterized by a subjectively unpleasant or distressing restlessness and need to move, often accompanied by the inability to sit or stand still. This is most likely to occur within the first few weeks of treatment. In patients who develop these symptoms, increasing the dose may be detrimental and is not recommended. What about discontinuation symptoms? So patients currently taking Luvox should not be discontinued abruptly due to the risk of discontinuation syndrome. At the time that the medical decision is made to discontinue an SSRI or other newer antidepressant drugs, a gradual reduction in the dose rather than an abrupt cessation is recommended. What about bone fracture risk? Epidemiological studies show an increased risk of bone fractures following exposure to some antidepressants, including SSRIs and serotonin or norepinephrine reuptake inhibitors, SNRIs. The risk appears to be greater at the initial stages of treatment, but significant increased risks were also observed at later stages of treatment. The possibility of a fracture should be considered in the care of patients treated with Luvox. Elderly patients and patients with important risk factors for bone fractures should be advised of the possible adverse events which increase the risk of falls, such as dizziness or orthostatic hypotension, especially at the early stages of treatment, but also soon after withdrawal. Preliminary data from observational studies show association of SSRIs and SNRIs and low bone mineral density in older men and women. Until further information becomes available, a possible side effect on bone mineral density with long-term treatment with SSRIs and SNRIs, including Luvox, cannot be excluded, and may be a potential concern for patients with osteoporosis or a major risk factor for bone fractures. What about if you had cardiovascular issues? So if you had cardiovascular illness, Luvox has not been evaluated or used to any appreciable extent in patients with recent history of a heart attack or unstable heart disease. Patients with these diagnoses were systematically excluded from pre-marketing clinical trials. Now, dependence and tolerance. So discontinuation of treatment with Luvox. When discontinuing treatment, patients should be monitored for symptoms which may be associated with discontinuation. Example, dizziness, abnormal dreams, sensory disturbances, including paresthesia and electric shock sensations, sleep disturbances, including insomnia and intense dreams, agitation, irritability, anxiety, fatigue, confusion, emotional instability, headache, tremor, nausea, vomiting or diarrhea, sweating or palpitations, or other symptoms which may be of clinical significance. Generally, these events are mild to moderate and are self-limiting. However, in some patients, they may be severe and/or prolonged. They usually occur within the first few days of discontinuing treatment, but there have been very rare reports of some symptoms in patients who have inadvertently missed a dose. A gradual reduction in the dosage over several weeks, rather than an abrupt cessation, is recommended whenever possible. If intolerable symptoms occur following a decrease in dose or upon discontinuation of treatment, dose titration should be managed on the basis of the patient's clinical response. Endocrine and metabolism, so a disturbance of glycemic control. Glycemic control, so your blood sugar, may be disrupted, especially in the early stages of treatment. Reported events include hyperglycemia, hypoglycemia, so it would be high and low blood sugar, diabetes mellitus, and decreased glucose tolerance. These have been reported in both patients with and without pre-existing disturbance of glycemic control. Patients should therefore be monitored for signs and symptoms of glucose fluctuations. When Luvox is given to patients with a known history of diabetes mellitus, the dosage of anti-diabetic drug may need to be adjusted. What about abnormal bleeding issues? So SSRIs and serotonin, or so SNRIs, including Luvox, may increase the risk of bleeding events by causing abnormal platelet aggregation. Concomitant use of ASA, non-steroidal anti-inflammatory drugs, warfarin, and other anticoagulants may add to the risk. Case reports and epidemiological studies have demonstrated an association between the use of drugs that interfere with serotonin reuptake and the occurrence of gastrointestinal bleeding or gynecological hemorrhage. Bleeding events related to SSRIs and SNRIs use have ranged from epistaxis, pediatry, of life-threatening hemorrhage. So basically it goes from non-life-threatening to life-threatening. So there's a big range of bleeding that can occur. What about liver? So treatment with Luvox has been rarely associated with increase in hepatic enzymes, usually accompanied by symptoms. So Luvox administration should be discontinued in such cases. All right, so does Luvox cause seizures? So seizures are a potential risk with antidepressant drugs. Convulsions have been reported rarely during Luvox administration, but Luvox has not been systematically evaluated in patients with seizure disorder. Caution is recommended when the drug is administered to patients with a history of seizures. Luvox should be avoided in patients with unstable epilepsy, and patients with controlled epilepsy should be carefully monitored. Treatment with Luvox should be discontinued if seizures occur or if seizure frequency increases. Seizures have also been reported as a discontinuation symptom. Serotonin syndrome and neuroleptic malignant syndrome. On rare occasions, development of a serotonin syndrome or neuroleptic malignant syndrome-like events have been reported in association with treatment of Luvox, particularly when given in combination with other serotonergic or neuroleptic or antipsychotic drugs. As these syndromes may result in potentially life-threatening conditions, treatment with Luvox should be discontinued if patient develops a combination of symptoms, possibly including hyperthermia, rigidity, myoclonus, autonomic instability with possible rapid fluctuations of vital signs, mental status changes including confusion, irritability, or extreme agitation progressing to delirium and coma, and supportive symptomatic treatment should be initiated. Due to the risk of serotonergic syndrome, Luvox should not be used in combination with MAOIs or serotonin precursors, and should be used with caution in patients receiving serotonergic drugs or neuroleptic and antipsychotic drugs or St. John's wort. Cognitive and motor disturbances. So sedation may occur in some patients. Therefore, patients should be cautioned about participating in activities requiring complete mental alertness, judgment, and physical coordination, such as driving an automobile or performing hazardous tasks, until they are reasonably certain that the treatment with Luvox does not affect them adversely. So psychiatric, suicide and suicidal thoughts, or clinical worsening. The possibility of a suicide attempt is inherent in depression and other psychiatric disorders and may persist until significant remission occurs. Patients with depression may experience worsening of their depressive symptoms and/or emergence of suicidal ideation and behaviors, suicidality, whether or not they are taking antidepressant medications. Close supervision of patients should accompany drug therapy, and consideration should be given to the need for hospitalization of high-risk patients. Patients with a history of suicide-related events or those exhibiting a significant degree of suicidal ideation prior to commencement of treatment are known to be at a greater risk of suicidal thoughts or suicide attempts and should receive careful monitoring during therapy. Physicians should encourage patients of all ages, their families, and their caregivers to be alert of the emergence of any new or worsening distressing thoughts or feelings occurring at any time, and especially when initiating therapy or during any changes in dose or dosage regimen. In order to minimize the risk of overdose, prescriptions for Luvox should be written for the smallest quantity of drug consistent with good patient management. Because of the well-established comorbidity between depression and other psychiatric disorders, the small precautions observed when treating patients with depression should be observed when treating patients with other psychiatric disorders as well. Example, obsessive compulsive disorder. Mania and hypomania. A major depressive episode may be the initial presentation of bipolar disorder. Patients with bipolar disorder may be at an increased risk of experiencing manic episodes when treated with an antidepressant alone. Therefore, the decision to initiate symptomatic treatment of depression should only be made after patients have been adequately assessed to determine if they are at risk for bipolar disorder. Luvox should be used with caution in patients with a history of mania or hypomania. Luvox should be discontinued in any patient entering a manic phase. Now speaking about your kidneys, so low sodium. As with other SSRIs, low sodium has been rarely reported and appeared to be reversible when Luvox was discontinued. That's pretty much the main point there. Fertility. Reproductive toxicity studies in rats have shown fluvoxamine impairs male and female fertility. Animal data have shown that Luvox may affect sperm quality. Human case reports with some SSRIs have shown that an effect on sperm quality is reversible. Impact on human fertility has not been observed so far. Luvox should not be used in patients attempting to conceive unless the clinical condition of the patient requires treatment with Luvox. Pregnant women and newborns. Safe use of Luvox during pregnancy has not been established. Therefore, Luvox should not be used during pregnancy or in women intending on becoming pregnant unless, in the opinion of the treating physician, the expected benefits of the patient outweigh the possible hazards to the fetus. Patients should be advised to notify their physician if they become pregnant or intend to become pregnant. If Luvox is used until or shortly after birth, discontinuation symptoms in the newborn should be considered. Nursing women. Safe use of Luvox during lactation has not been established. Like other antidepressants, fluvoxamine is excreted via human milk in small quantities. Luvox should not be administered to nursing mothers unless, in the opinion of the treating physician, the expected benefits outweigh the risk. All right, so that concludes precautions and warnings. We'll now discuss adverse reactions. So, adverse drug reaction. Adverse event information for Luvox was collected from adult patients diagnosed with major depressive disorder or obsessive compulsive disorder and treated with Luvox in controlled trials. Adverse events leading to discontinuation of treatment. Of the 1,087 patients with MDD or OCD that were treated with Luvox in controlled clinical trials, 22% discontinued due to adverse events. Adverse reactions that led to discontinuation in at least 2% of Luvox treated patients in these trials were nausea, 9%, insomnia, 4%, somnolence, 4%, headache, 3%, and asthenia, vomiting, nervousness, agitation, and dizziness, 2% each. Adverse events with an incidence of greater or equal to 5% reported in double-blind, placebo-controlled trials in depression and in obsessive-compulsive disorder are presented in the following table. Okay, so we'll just go through it for the depression side of things. So it has 2 columns for depression, 2 columns for OCD, and we'll just rhyme off some of them here. So somnolence, 26%, agitation, 16%, insomnia seems to have happened 14% of the time, dizziness, 15%, tremor, 11%, and as I'm going through these, you can compare these numbers to the numbers of that of placebo. So if there's a big difference, then more likely to have that side effect. Depression, 4%, same as placebo. Nervousness, 2%, same as placebo. Anxiety is same as placebo as well. Nausea, 37%. Dry mouth, 26%. Constipation, 18%. Anorexia, 15%. Diarrhea, 6%, but it's the same as placebo. And upset stomach, 3%. 22% experienced a headache, 6% pain, 5% asthenia or abnormal weakness, and abdominal pain was the same as placebo. Sweating increase was actually more with placebo. And 1% for abnormal ejaculation. Adverse reactions following discontinuation of treatment. There have been reports of adverse reactions upon the discontinuation of Luvox, particularly when abrupt, including but not limited to the following. So dizziness, abnormal dreams, sensory disturbances, sleep disturbances, agitation, irritability, anxiety, fatigue, confusion, emotional instability, headache, tremor, nausea, vomiting, diarrhea, sweating, palpitations, or other which may have clinical significance. Isolated cases of withdrawal symptoms in the newborn child have been described after the use of Luvox as well at the end of pregnancy. And they talk about less common side effects, which we won't go over. Talk about metabolism, which I don't think is too important to go over fully here. I will read the overview. So metabolism of fluvoxamine. So fluvoxamine is mainly metabolized by CYP2D6. CYP2D6 is responsible for the metabolism of substrates such as tricyclic antidepressants, phenothiazines. In vitro data suggests that fluvoxamine is a relatively weak inhibitor of CYP2D6, and hence the potential of interactions with compounds metabolized by this isoenzyme is low. We talked about monoamine oxidase inhibitors. Drug-drug interactions. No use of going over that. So dosage considerations. So Luvox is not indicated for the use in children under 18 years of age. Talk about use in children. All right, here we are. Adult dosage. So treatment should be initiated at the lowest possible dose, 50 milligrams, given once daily at bedtime, and then increased to 100 milligrams daily at bedtime after a few days as tolerated. The effective daily dose usually lies between 100 milligrams and 200 milligrams and should be adjusted gradually according to the patient's individual response and tolerability, up to a maximum of 300 milligrams. Dosage increases should be made in 50 milligram increments. Doses above 150 should be divided so that the maximum of 150 milligrams is given in the bedtime dose. Now, what about the adult dosage in obsessive compulsive disorder? Treatment should be initiated at the lowest possible dose, 50 milligrams, given once daily at bedtime, and then increased to 100 milligrams daily after a few days. The effective daily dose usually lies between 100 and 300 milligrams and should be adjusted gradually according to the patient's individual response and tolerability, up to a maximum of 300 milligrams. If no improvement is observed within 10 weeks, treatment with Luvox should be reassessed. Dosage increases should be made in 50 milligram increments. Doses above 150 should be divided so that the maximum of 150 is given at the bedtime dose. If somebody has liver or kidney insufficiency, patients with hepatic or renal insufficiency should begin treatment with a low dose and be carefully monitored. If you miss a dose, the next dose should be taken at the normal time. Luvox should be swallowed whole with water and without chewing. Now, what about overdosage? So since market introduction, reports of overdosage have been rare, and reports of death attributed to Luvox overdose alone have been extremely rare. The smallest estimated dose of Luvox alone associated with a fatal outcome is approximately 1,800 milligrams. The highest documented dose of fluvoxamine ingested by a patient is 22,000 milligrams. This patient recovered completely. In the majority of reported cases, the patients were taking multiple drugs in addition to fluvoxamine. In such cases, it is difficult to differentiate the additive drug effects or drug interactions that may have impacted patient outcome. The most common symptom of overdose include gastrointestinal complaints such as nausea, vomiting, and diarrhea, somnolence, and dizziness. Cardiac events such as rapid heart rate or slow heart rate or low blood pressure. There's also liver function disturbances, and convulsions and coma have also been reported. And lastly here, we'll just discuss the mechanism of action. So the antidepressant and anti-obsessional actions of Luvox are believed to be related to its selective inhibition of presynaptic serotonin reuptake in brain neurons. I don't think it's important to go over pharmacokinetics or pharmacodynamics, so I think that may conclude this monograph review of fluvoxamine. I hope you enjoyed this video. As always, with videos like this, I will chop them up and make smaller videos out of the content. But as always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable, you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. So for today, take care.